Hi, my name's Abby. I'm the Clinical Nurse Advisor at Armstrong Medical, and today we're going to go through the use of high flow in the pre-operative setting. High flow oxygen therapy is delivered through the patient's nasal passages using specialised equipment. It utilises oxygen-rich gases that have been heated and had water vapour added to optimally condition them. These conditioned gases are then blown into the upper airway at high flow rates exceeding 45 litres per minute. This technique can be used to oxygenate a patient preoperatively. Deoxygenation increases the oxygen reserve, delays the onset of hypoxia, and allows more time for tracheal intubation and for airway rescue should intubation fail. The Difficult Airway Society in 2015 recommends that all patients should be pre-oxygenated before the induction of general anaesthesia. This can be delivered via a face mask, nasal cannula, or the transnasal humidified high-flow oxygen. How is pre-oxygenation with high flow beneficial? So first of all, we have that improved alveolar ventilation, also known as your reduction of dead space. So that delivery of high flow oxygen clears out the upper airways, creating a humidified fresh gas reservoir. So it basically washes out our nasopharyngeal area, which reduces the anatomical dead space. The enhanced alveolar ventilation that this reduction on dead space provides contributes to better pre-oxygenation through increasing the volume of oxygen available in the alveoli. The oxygen reservoir in the upper airways provided via your high flow oxygen therapy prevents entrainment of room air, so this reduces the dilution of inspired gases. Alongside this, our nasopharyngeal dead space washout. This clears waste gases from the upper airway, which prevents rebreathing of carbon dioxide. So this further minimises dilution of inspired gases delivered at 100% oxygen. Both benefits ensure the concentration of gases delivered to the alveoli are more accurate and similar to what is dialed on the device. So this accurate FiO2 delivery ensures there's a higher concentration of oxygen in the alveoli for improved pre-oxygenation. There is also a variable positive airway pressure, and this effect provided by high flow during pre-oxygenation aids in recruiting alveoli and enhancing lung function for optimal pre-oxygenation. This is dependent on flow rate, so whether the patient's mouth is closed or open, and the size of the nasal cannula and the nares. The alveolar recruitment and pre-oxygenation may also benefit patients at risk of post-op atelectasis. The heated and humidified gases used during high flow therapy improve your mucociliary clearance. So mucociliary clearance is affected by this coordinated beating of your cilia, and it's the first line of defence to maintain pulmonary health and is responsible for clearing both the upper airways and the lower airways of mucus, particulate matter and pathogens. And during surgery, that airway can become dry due to a variety of different factors, including the use of anaesthesia, the administration of dry oxygen through a breathing circuit, and then the natural evaporation of moisture from the airway. When the patient receives a warm and moist gas mixture before surgery, it can then reduce the risk of post-operative complications such as irritation and inflammation in the airways, which can lead to coughing, difficulty breathing, and other respiratory problems. So heating and humidifying the gases can also ensure patient comfort and alleviate a bit of patient anxiety. The nasal cannula, unlike the face mask, can remain in place during attempts at tracheal intubation. In theatre, general anaesthesia and inadvertent hypothermia is a common issue. So it results from a combination of things. So you've got your anaesthetic impaired thermoregulation and that exposure to a cold operating room environment. This, along with the exposure of body cavities and blood loss, can trigger your defences and lead to a hypothermia. Hypothermia itself is associated with increased morbidity and mortality in surgical patients. So these heated and humidified gases are heated to a relative humidity of 100%, which helps prevent that dehydration of your mucous membranes, therefore maintaining normothermia by reducing heat loss through the respiratory tract. Further benefits to patient comfort and experience can be found in the use of a comparatively small interface to pre-oxygenate when compared to a face mask, which may cause patient to feel a bit more disorientated and claustrophobic, especially due to the need to be laying down. High flow pre-oxygenation can be delivered while the patient is sitting up to prevent disorientation and promote better efficiencies, as pre-oxygenation can be taking place while the patient talks through their history. It can also give some relief from the dry throat following fasting, which may be found due to the humidified gases in use. Thrive technique uses a physiological concept known as aventilatory mass flow. This allows for an extended apneic window during theatre while maintaining safe oxygen saturations. So AVMF is the passive movement of oxygen from the fresh gas reservoir into the lungs for gas exchange. And during this process, high flow creates a fresh gas reservoir, ensuring that constant supply of oxygen in the upper airways, which is then drawn into the lungs due to a negative pressure gradient forming in the lower airways during apnea. So during apnea, oxygen diffuses into the blood at a normal rate. However, the rate that CO2 or carbon dioxide diffuses into the lungs significantly decreased. This imbalance creates a negative pressure gradient in the lungs, drawing fresh gas from the high flow oxygen reservoir in the upper airways into the lungs. As long as the patient's airway remains open, a pathway exists to atmosphere and the pressure gradient draws oxygen from the fresh gas reservoir. Using the Thrive technique, this allows for the continual oxygenation of a patient for lengths of time far exceeding the standard apneic window. It has been shown in some cases to extend the apneic time up to 65 minutes. And this technique is particularly beneficial in a difficult airway scenario. The benefits to the theatre department in terms of increased patient safety and throughput of cases are just some of the positive impacts the introduction of high flow to deliver Thrive can present. High flow is more than simply a tool for delivering oxygen. It's a holistic approach to patient care. By washing out the anatomical dead space, it can optimise pre-oxygenation and increase your oxygen reserve. It can also delay the onset of hypoxia, and the variable positive airway pressure aids in recruiting the alveoli, which can benefit patients at risk of post-op atelectasis. The addition of the heated and humidified gases improves mucociliary clearance and patient tolerance of the therapy and maintain that normal body temperature in theatre. If you have any questions or comments, please feel free to leave them in the comments section below. Don't forget to check out our website for more information on high flow oxygen therapy for perioperative care.